I am debating between a brow lift or upper eyelid surgery. Any suggestions? I have dry eyes, and the surgeon I visited said that I should not do upper eyelid surgery. Would the brow lift be less taxing on my eyes?
Thank you for your question. You submitted a single photo and you are stating in your question that you visited a surgeon about upper eyelid surgery. However, your surgeon did not recommend that, and it seems to be in the context of the presence of dry eye. And you're asking, would a brow lift surgery be less taxing on your eyes? Well, I can certainly give you some guidance with this question. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and cosmetic eyelid surgery and brow lifting surgery, face lifting surgery, basically a lot of the area procedures and solutions for facial aging is the core of my practice. This includes non-surgical solutions like injectables and various advanced methods of using blunt cannulas, as well as laser devices, thermal energy devices. So basically, in your situation, having dry eye is an important issue, but the question that it remains is whether or not a brow lift would make an impact, not so much from a dry eye perspective in my mind, but really from an aesthetic perspective. You see, what you're clearly concerned about is the appearance of some extra skin over your eyes, which is why probably you considered eyelid surgery. Well, the reason why a lot of surgeons are very much concerned about dry eye is because if they don't have an ophthalmology background, and eyelid surgery is typically and annually the third most popular cosmetic surgery, they don't have an ophthalmology background. Very often there are some issues with management of dry eye, and very often the surgeon who performs the procedure isn't the doctor who manages the dry eye. Myself, as having an ophthalmology background, I'm very familiar with dry eye and oculoplastic surgery. We are specialized in the lacrimal system, which is the tear gland and tear duct system. So I've performed blepharoplasty for many patients with severe dry eye. It's all about management, because that's ultimately basically something that I said years ago, and it still remains to be true, is that eyelids that look good function well. So in and of itself, I would say that it doesn't quite make sense to me that a brow lift would be of benefit because it would be less taxing to the health of your eyes. From my perspective, from the aesthetic perspective, I would say a brow lift would not be a good idea. Looking at the photo, the position of your brows seem high enough. I would ask you to imagine how much higher the brow lift would be to get that skin to be more taut. So, and unfortunately, I think that if you were to undergo the brow lifting procedure, from my view, it wouldn't look very natural, and you might look a little more surprised than you want to look. I think that there are more than a few options for you, and it might be to your benefit to actually meet with someone who is more of a cosmetic oculofacial plastic surgeon, because there is certainly some critically important issues when it comes to the health of the eye that are raising concern for you, and someone with an ophthalmology background was simply just going to be much more comfortable with that issue. Now, it may be that blepharoplasty or brow lift may not be optimal for you, and you may just have to wait, but a proper examination by a specialist, I think, is indicated in this situation, with all due respect to the doctor that you went to. So meet with a specialist, as I described, and see if you can get some more clarity about the basis of any suggested procedure. It is so important to have good communication and really understand what the outcome will be and what the impact will be on the health of your eyes. You really want to be sure to make this as smooth a process as possible. So I hope that was helpful. I wish you the best of luck. And thank you for your question.